All right, let's take a look at a second heart model right here, looking at these same structures. Now, if we start with a little front anterior view of the heart, we got superior vena cava over here in blue. Again, that returns all blood back from anywhere above the heart. So your head, neck, both upper limbs, upper part of your chest, all return their blood to that superior vena cava into that right atrium, which is what it's connected to. There's our aorta. Again, that's what our left ventricle pushes blood into, and that takes blood through many different arteries from the top of your head to the tip of your toes. Right here beside it in blue is the pulmonary trunks, what your right ventricle pushes blood into. Go up this pulmonary trunk and it splits left and right into pulmonary arteries. You can see those in blue on the back right there. That's going to take blood to your lungs. But looking superficially here from the front, here's where we have our right atrium. Over here's our left atrium, and most of it's posterior to the back. But you can see the little auricle, what's called the little ear flaps on the atria, right here, right and left. So if you ever see auricle labeled, it's just little flaps of tissue off of those upper chambers. Here's our right ventricle and our left ventricle. And notice how a lot of that left ventricle is also to the back. And then if we flip this over right here, we can see more of a rear posterior view. There again is our superior vena cava, and down here's our inferior vena cava. As the superior vena cava returns blood from above the heart, the inferior returns blood from beneath the heart. And then the blood from the heart muscle is going to drain into this coronary sinus, and that goes into that right atrium too. We'll see that on the inside. But here again is our aorta in red. There's the very top of our pulmonary trunk where it splits into pulmonary arteries on either side, right and left. And then shown here in red are the pulmonary veins. That's how blood gets back from the lungs into this left atrium right here. But if we go back to the little front anterior view here, there again is your right atrium, right ventricle, left ventricle. And if we open this up, here we go, just pulled the front off of it right there, and flip this back right here, there again is our right atrium. 3 inflows of blood into it, superior vena cava, inferior vena cava at the bottom, and then this third hole in here is the coronary sinus. That's blood coming back from the heart muscle itself right there. So 3 inflows of blood into that there. If we leave the right atrium, blood's going to have to get through your tricuspid valve, also called your right atrioventricular valve. Here you can see what looks like little tendon strings. That's what's called the chordae tendineae, and down here below it's your right ventricle. And you can see little papillary muscles attached to those little strings, the chordae tendineae. We can see the interventricular septum. That's a wall in between our right and left ventricle. So here's our left ventricle here. There's the bicuspid valve, you can see back up in there. And notice how most of our left atrium is to the back. And notice on either side of it, you can see the pulmonary veins. There's a pair of them on the right and left, returning blood back from the lungs. If we look right here at the base of the pulmonary trunk, there's our pulmonary semilunar valve. If we go over here to the bottom of the aorta, there's our aortic semilunar valve. So again, looking at your valves, there's your tricuspid, your bicuspid, pulmonary semilunar, and aortic semilunar right up under there. Now if we put this front back on it, and we look at some of the structures, you see a little bit more, say some of the smaller arteries and veins. Well, there's 7 major arteries that take blood to your cardiac muscle. Right here in red, we've got your right coronary artery. If you follow this right coronary artery down, right here on the edge in red, you got the right marginal. So right coronary leads to right marginal. But also if you follow the rest of that to the back, it becomes in red the posterior interventricular artery. So that is right coronary to right marginal to posterior interventricular. And if we go back to the front, the left coronary is underneath this pulmonary trunk. You can't see it. But the left coronary has a branch right here coming down the front called the anterior interventricular artery. Then over here on the side, we got a little small piece of the circumflex, and then that leads to the left marginal, right here again on the edge, the margins, just as you would expect. Now there's also 3 big veins that take blood out of the cardiac muscle. Right here's the great cardiac vein. It's draining a lot of blood out of this left ventricle. Since that's your biggest pump with the most muscle, a lot of blood. So they call that the great cardiac vein. Over here on the side in blue, you've got the small cardiac vein. And then on the back, you've got the middle cardiac vein. And all three of those veins drain into this big blue piece right here called the coronary sinus, and that leads into that right atrium, returning blood from the heart muscle, just as the inferior vena cava returned it from below the heart, and the superior vena cava returned it from above.